Good morning everyone. Today we will see important topic of cardiovascular system that is physiology of shock. It is also called circulatory shock. So we will see the definition and different types of shock and the signs and symptoms and stages of shock and finally treatment of shock. So this is very important in the exam point of view and also practical purposes. So coming to the definition of shock, it is a syndrome. So syndrome means a collection of different entities that share certain common features. So syndrome characterized by serious reduction of tissue perfusion with a relatively or absolutely inadequate cardiac output. So I am reading again. Syndrome, which is a collection of different entities that share certain common features. Okay, so different entities means the complaints which the patient gives. So those things which share common feature are together called syndrome. So the syndrome characterized by serious reduction of tissue perfusion. So perfusion means blood flow, blood supply. So that supply is decreased with relatively or absolutely inadequate cardiac output. So this inadequate cardiac output is very important in the definition of shock. So it is a condition characterized by an inadequate delivery of oxygen and nutrients to critical organs such as heart, brain, liver, kidneys and gastrointestinal tract. Okay, so the same meaning. So it is characterized by inadequate delivery of oxygen and nutrients to critical organs. The types of shock are four types. The first one is hypovolemic or hemorrhagic shock, and the second one low resistance or distributive or vasogenic shock, and third one cardiogenic shock, and lastly obstructive shock. So out of these four types, the first one, hypovolemic or hemorrhagic shock, is the most important and most commonly observed type of shock. The circulatory shock we can divide into two. One is with decreased cardiac output and one is without decreased cardiac output. So this without decreased cardiac output is called distributive shock or vasogenic shock. So this is again divided into septic, anaphylactic and neurogenic shock. So in this shock which is due to decreased cardiac output, again we have three types. So one is cardiogenic, that is due to cardiac abnormalities which decrease the ability of heart to pump. So the cardiac abnormalities may be like myocardial infarction, heart failure and arrhythmias. And then the factors that decrease the venous return which decrease the cardiac output are categorized under hypovolemic shock. And the restricted cardiac filling and obstruction in the outflow tract. Okay, so from the heart the outflow is being restricted and also the cardiac filling will be restricted. So that is categorized under obstructive shock. So we will see these four types of shock. The first one will be hypovolemic or hemorrhagic shock. It results from trauma in which there is blood loss, and the decreased blood volume causes a decrease in blood pressure, and insufficient amounts of oxygen is being transported to body tissues and organs. So this type of shock, hypovolemic shock, which commonly results from the hemorrhage or trauma or burns or surgery. So this there will be decreased blood volume which causes decreased in blood pressure, and so that the oxygen which is transported to body tissues and organs will be decreased. So it is we can say acute hemorrhage of more than 15 ml per kg body weight results in this type of shock. So the most common type of shock, and these are all the various causes for the shock. The first and most common is loss of blood or hemorrhage. This is because of external bleeding or internal bleeding. And then loss of plasma because of burns and exfoliative dermatitis. And then loss of fluids and electrolytes which may take place externally, that is vomiting and diarrhea, and internally, that is the third spacing, which is because of pancreatitis inflammation. In these conditions will lead to loss of fluid from the body and then excessive sweating. The stages of hypovolemic shock are mild, moderate and severe. Mild is when the loss of blood volume is less than or equal to 20%. In this there will be few external signs in supine young patients and there will be increased capillary refill time. And moderate is loss of 20 to 40% of blood volume. In this the patient becomes increasingly anxious and tachycardia will be present, which will be more than 100 beats per minute. That is because of sympathetic response. And oliguria will be present. Blood pressure may be maintained in supine patient. And severe shock is loss of more than 40% of blood volume. In this stage, classic signs of shock appear with hemodynamic instability. Only very short time frame may separate mild and severe shock symptoms that lead, when left untreated, to progressive and irreversible cell injury and death. Okay, so the time frame for differentiating these three types or stages of shock is very little. Okay, it will be in seconds only. So when left untreated, these stages finally lead to progressive and irreversible cell injury and death of the patient. Signs and symptoms of hemorrhagic or hypovolemic shock are low blood pressure, that is systolic BP usually below 90 mmHg, and pulse is rapid and weak, respiration is rapid and shallow, skin is pale, cool and clammy, and there will be drowsiness. So these are very important signs and symptoms which if you notice in a shock patient, that is the most commonly you will see these shock patients in traumatized area or accident area. So rapid and pulse, weak pulse, and rapid and shallow breathing, and skin which is pale, cool and clammy, and drowsy condition of the subject. So these are the most common signs and symptoms. And the treatment for hypovolemic shock is maintaining the airway. So that is nose, trachea and then the lungs. So this airway which should be maintained, and administering high flow oxygen and control the severe bleeding, keep the patient warm, elevate the lower extremity to increase the venous return, and establish the intravenous cannula, that is IV route, and administer bolus of crystalloid solution for fluid replacement. So IV fluids are the final treatment for hypovolemic shock. And again we can divide the stages of hypovolemic shock into non-progressive, progressive and refractory or irreversible stage of shock. So we can also classify into compensated shock, decompensated shock and irreversible or refractory shock. So the compensated is the early stage of shock where body's compensatory mechanisms are able to maintain normal perfusion to the critical organs. And the decompensated is the advanced stage that occurs when body's compensatory mechanisms fail to maintain normal perfusion. And irreversible stage that has progressed to the point that body or the medical interventions correct the problem. The first stage or non-progressive shock, also called compensated shock, in which there is a moderate reduction in cardiac output. So this occurs in hemorrhagic or hypovolemic shock when at least 10 to 15% of total blood volume is lost. So this is a list of compensatory mechanisms which are activated immediately after hemorrhage to maintain the normal blood volume. So the first and foremost important one is vasoconstriction and tachycardia and venoconstrictions, which are due to stimulation of sympathetic nervous system, and tachypnea, which leads to increased thoracic pumping, and restlessness leads to increased skeletal muscle pumping in some cases, and increased movement of interstitial fluid into the capillaries, increased secretion of norepinephrine and epinephrine, increased secretion of vasopressin, increased secretion of glucocorticoids, increased secretion of renin and aldosterone leading to activation of renin-angiotensin system, and increased secretion of erythropoietin and increased plasma protein synthesis. So you have to remember this list of compensatory mechanisms and you need to explain each one, every one in a single line. So these compensatory mechanisms occurs in hemorrhagic shock when there is 10 to 15% of blood volume loss. So these compensatory mechanisms of rapid onset, that is short-term mechanisms, immediately set into motion following acute loss of blood and try to maintain the blood flow to vital organs in spite of reduced cardiac output. The rapid compensatory mechanisms are mainly neural. So these mechanisms are mainly the baroreceptor reflex, chemoreceptor reflex and central nervous system ischemic response. So all these three you have already seen in the regulation of cardiovascular system. So these will be coming within seconds. So coming into action within seconds when the blood pressure is decreased. So when the blood pressure is decreased automatically in hypovolemia also because of decreased blood volume. And then the intermediate compensatory mechanisms are renin-angiotensin vasoconstrictor mechanism and reverse stress relaxation capillary fluid shift mechanism. So this also will be coming under the blood pressure regulation. So if you know those regulation of cardiovascular and regulation of blood pressure, so you can easily write this compensatory mechanisms which will be coming under the hemorrhagic shock. And then the long-term compensatory mechanisms which are restoration of plasma volume and proteins and restoration of red cell mass. Second stage or progressive stage of shock occurs when there is 15 to 25% loss of total blood volume is present, and here the compensatory mechanisms are unable to stop the progression of shock. So there will be progressive deterioration of structures of the circulatory system, and there will be development of various positive feedback cycles. So you know the positive feedback cycles in your starting class, that is homeostasis. So the positive feedback cycles which developed in the progressive stage are cardiac failure leading to decreased pumping of blood and vasomotor, that peripheral blood vessels also will be failed, and peripheral circulatory failure, and then the septicemia and toxicemia will be setting in finally. So the third stage is irreversible or refractory stage, so where all the types of shock will lead to failure of the multi-organ system. So in hypovolemic shock there is reduced cardiac preload, and in cardiogenic shock reduced systolic performance, and obstructive shock there will be reduced ventricular filling during systole, which all these three will lead to decreased stroke volume. And the distributive shock will lead to severe depression of myocardium and marked fall in peripheral resistance, which will lead to hypotension and then decreased stroke volume, and hypotension will lead to decreased cardiac output, and these three also will lead to decreased cardiac output, which will lead to severe reduction in tissue and organ blood flow. And here, because of decreased peripheral resistance, alteration in distribution of blood flow in microcirculation, which both of these together will lead to failure of multi-organ system. So if any type of shock is present, that if left untreated will finally lead to the failure of multi-organ system, which is the third stage or the irreversible stage of shock. So this is a flowchart of the irreversible or refractory stage of shock. So the shock which is in progressive stage, if not treated adequately, will lead to vicious cycle of various positive feedback mechanisms to set in, and the patient passes into the third stage or irreversible stage of shock. So that is the refractory shock. All therapeutic interventions ineffective will become ineffective and patient eventually dies. So the positive feedback cycles are the cardiac failure, peripheral circulatory failure, and septicemia and endotoxemia. So how the septicemia takes place means The hypoxic damage to the GI tract, that is the decreased oxygen supply to the gastrointestinal tract, disrupts the mucosa of the intestine that allows the entry of normal flora of the intestine into the circulation. So that bacteria which enters the circulation will lead to bacteriemia and septicemia. So that endotoxins released from the bacteria and toxic materials from the septic tissues will lead to endotoxemia and septicemia. So now we will see the other three types of shocks in brief. So the first one is cardiogenic shock. So in this, the heart loses the ability to supply all parts of the body with blood, usually the result of left ventricular failure secondary to acute myocardial infarction or coronary heart failure. Many patients will have normal blood pressures. Okay, so because of the cardiac abnormalities like acute MI or heart failure, there will be left ventricular failure to pump the blood to the systemic arteries, that is the aorta, descending aorta, and then the peripheral systemic arteries. So the patients will have normal blood pressures. So the causes for the cardiogenic shock are pump failure because of MI, cardiomyopathy, and valvular dysfunction, and then arrhythmias like tachyarrhythmia and bradyarrhythmia, and obstruction because of tension, pneumothorax, pericardial disease, pulmonary hypertension. So these will come under obstructive type of shock. So the features of cardiogenic shock are low cardiac output, peripheral vasoconstriction, and left-sided heart failure leading to pulmonary venous congestion and pulmonary edema, and right-sided heart failure leading to systemic venous congestion and peripheral edema. So left side of the heart, if it fails, lead to lung damage, that is the blood in the lungs will be congested. Okay, so that is called pulmonary venous congestion and pulmonary edema. And if the right side of the heart fails, that lead to systemic venous congestion and peripheral, because from the right side of heart receives blood from the entire body, that is venous return, and left side of heart receives blood from the lungs, that is the purified blood. And then the symptoms of cardiogenic shock are, the major difference between the other types and this cardiogenic is that presence of pulmonary edema in the cardiogenic shock, and difficulty in breathing, wheezes, crackles, rales are heard as fluid levels increase in the lungs. So these are all the abnormal sounds which we listen in the lungs. Okay, and productive cough with white or pink tinged foamy sputum, and then cyanosis, altered mentation, and oliguria, decreased urination. And the treatment for cardiogenic shock is airway control again. The first basic thing, treatment for any type of shock is assuring the airway, the open airway, and administering oxygen, assisting ventilation as needed, keeping the patient warm, place the patient in position of comfort, establish IV connection with minimal fluid administration, monitoring vitals, and many to administer dopamine and dopamine, which are the inotropics. So the distributive shock is also called low resistance or vasogenic shock, and where there is the compromisation of cardiac output or decreased cardiac output is not present. Actually, what happens in this type of shock is that there will be increased capacity of the vascular blood because of sudden increased vasodilation of the blood vessels. So because of the vasodilation, there will be increased capacity of the vascular blood. The blood volume increases. So this is otherwise called warm shock, which in comparison or in contrast to the hemorrhagic shock, which is called cold shock, because the skin will be cold and clammy because of acute vasoconstriction. But here in the distributive shock, there will be vasodilation, marked vasodilation. So that's why there will be increased skin blood flow. The blood vessels, skin blood vessels will be vasodilated. So the reasons for this type of shock are these three. One is sepsis because of this gram-negative and gram-positive bacteria, and anaphylaxis due to previous sensitization to an allergen, and neurogenic that is due to traumatic spinal cord injury and effects of epidural or spinal anesthetics and reflex parasympathetic stimulation. So these three are the most common types of distributive or vasogenic shocks. So the neurogenic shock, it results due to overall dilatation of blood vessels within the cardiovascular system. There will be decreased blood pressure and insufficient amounts of oxygen will be transported to body tissues and oxygen organs. The reason for neurogenic shock is that injury to the brain or spinal cord which causes interruption of nerve supply to the arteries. So the arteries will lose the tone, basic tone which is present in the arteries will be lost and thereby the arteries will dilate causing hypovolemia. So this is the major reason of neurogenic shock. So the sympathetic nerve impulses to the adrenal glands are lost. So that will be preventing the release of catecholamines which are responsible for vasoconstriction of the shock, and the compensatory mechanisms like tachycardia, venoconstriction, all those will be lost because of the sympathetic nerve supply which is lost. The symptoms of neurogenic shock are warm, dry and red skin, and the blood pressure will be decreased and the pulse will be very slow. And the treatment is again airway control, maintaining the body temperature, immobilization of the person if indicated, and consider the causes of shock, and IV administration of fluids and medications that increase the peripheral vascular resistance. That is because the sympathetic adrenal glands are not releasing the epinephrine and norepinephrine, we need to administer intravenously. And then dopamine, which is a inotropic. The next type is anaphylactic shock. The anaphylaxis is a severe acute systemic allergy. So the severe immune response to foreign substance will lead to anaphylaxis. The signs and symptoms often occur within minutes but can take up to hours to occur. The faster the reaction develops, more severe it is likely to be. And death of the person will occur if not treated the condition properly. The signs and symptoms of the respiratory system in anaphylactic shock are breathing difficulty, sneezing, coughing, wheezing, stridor, laryngeal edema, laryngospasm. And then the cardiovascular system, there will be vasodilation, increased heart rate and decreased blood pressure, and GIT, nausea, vomiting, abdominal cramping and diarrhea. So after knowing the symptoms, we need to treat the condition. So again the treatment will be airway control, which may include endotracheal intubation and establishing IV connection with crystalloids, and pharmacological interventions like administering epinephrine, antihistamines, corticosteroids, vasopressors and inhaled beta agonists. So if you don't know meaning of any word from this topic, you just look into the medical dictionary. So each and every word will not be explained in the lectures. You need to see the meanings in the medical dictionary. Make it a habit to use medical dictionary. And then the next type of shock is septic shock. An infection enters the bloodstream and is carried throughout the body. The toxins released overcome compensatory mechanisms. It can cause dysfunction of one organ system or cause multiple organ dysfunction. Okay, so the infection, how the bacteria enters into the bloodstream, I have explained you. So because of decreased, the disruption of the mucosa of GI tract because of hypoxia. So these toxins released from the bacteria will overcome the compensatory mechanism, causing dysfunction of the one or more organ systems, leading to multi-system organ failure. So the pathogenesis of this septic shock. The sepsis is defined as systemic inflammatory response to a bacterial infection with bacteriemia. Severe sepsis is defined by additional end organ dysfunction. Septic shock is defined as sepsis with hypotension despite fluid resuscitation and evidence of inadequate tissue perfusion. The clinical spectrum of infection in any infected individual. So any infection, like it may be fever, simple fever, to accident patient, or traumatic patient, injured patient. So if admitted in a hospital or if not admitted in a hospital and not treated properly, it will lead to this spectrum, that is one after the other. Like this, the infection will lead to bacteriemia and then sepsis and severe sepsis, and finally the patient may go into septic shock. So this word will be commonly used in infected patients. Also some patients which are admitted in the hospitals, though with the treatment they may not survive, they may not be getting back to normal because of this severe sepsis which sets into that person. Okay. And the basic pathophysiology is change in capillary permeability resulting in fluid loss to the tissue. So there is formation of arteriovenous shunts at the tissue level such that the systemic vascular resistance is low but tissue perfusion is poor. Okay, so this is the basic pathophysiology, that is the capillary permeability is changed resulting in fluid loss to the tissue. The syndrome of septic shock will be systemic vasodilation, that is hypotension, and diminished myocardial contractility and widespread endothelial injury and activation leading to fluid leakage resulting in acute respiratory distress syndrome. So this acute respiratory distress syndrome will be damaging the pulmonary circulation. So that is also called as shock lung, and activation of the coagulation cascade, that is disseminated intravascular coagulation. So again, the treatment of septic shock includes airway control, administering oxygen, IV fluids, and dopamine for blood pressure support, and monitoring the other vitals. So we have come to the end of the class. So in this class, we have seen the definition of shock and types of shock. And the most common and important type of shock is hypovolemic or hemorrhagic shock. So in that shock, we have seen the causes and the stages of shock and signs and symptoms, and then finally treatment. And we have also seen the other types like cardiogenic and then obstructive. So in the cardiogenic only I have told you obstructive, and then neurogenic, distributive. So in the distributive shock we have seen septic, anaphylactic and neurogenic shock. So all these are very important questions for both theory and practical. So especially for theory, this hypovolemic shock will come as an essay from cardiovascular system. So today's assignment will be define shock and write the types of shocks and explain in detail the various compensatory mechanisms which we will be seeing in the hypovolemic type of shock. Okay, so write down this essay question neatly with the diagrams. So you need to see from the textbook. You need to read from the textbook, not this PowerPoint, and write down on your own, not the seeing the slides, whatever in the there in the slides you are writing that only. So I don't want that. You need to read the textbook and write on your own. Okay, so thank you all.